All right, welcome to my presentation on disorders of consciousness, including brain death, and we will be going over a Catholic understanding. And my name is Paul Maxey, and I am doing this for a bioethics class with Father Luke Deisinger from St. John's Seminary. And also before seminary, I got my Bachelor's of Science in Nursing. So I have a little bit of knowledge that made this research pretty interesting. So to start, disorders of consciousness, we have to get some key terms. We have to get some key terms defined so we can understand what's being said and what exactly we're talking about. So our first key term is coma. And then we'll look at the persistent vegetative state, minimally conscious state, and lastly, brain death. Here is a definition of coma. It is continuously unconscious and unarousable when the patient is continuously unconscious and unarousable. No alternation of periods of wakefulness and sleep. So what does that mean? And usually it's temporary and can last a few weeks. So it sounds like if someone has a big injury or they take a big hit to their head or to their brain, that they can go into a coma. And in this state, they aren't waking up and falling asleep, but they are just out of it, knocked out for an extended period of time. A time period that can last a few weeks. Of course, there's going to be comas that last longer than that or comas that are shorter than that. But that was what I found on Father Luke's website. All right, the persistent vegetative state. Here's the definition it gives us. And the persistent vegetative state is a little bit different than a coma because in this situation, you'll look at the patient and the patient will have a period of time where they sleep and then they'll wake up. But it's what they're doing when they're awake or what they're not able to do when they're awake that characterizes this state of consciousness. So here's our definition. No evidence of self-awareness or conscious reaction to stimuli. Alternate periods of sleep and wakefulness. And so the key word that we want to focus on is awareness. While the patient wakes up and falls asleep, the patient is not aware of what is going on around them. Yeah. Okay, our third term is the minimally conscious state. So here's what we have. A condition of severely altered consciousness in which there is minimal but definite behavioral evidence of conscious awareness. So that word again, awareness, there is minimal evidence of awareness, but there is awareness. And that's what marks this state as opposed to the persistent vegetative state. Persistent vegetative state, the patient has no awareness of what's going on around them or even what's going on with themselves. To establish the diagnosis of the minimally conscious state, clearly discernible evidence of one or more of the following behaviors must be observed on bedside exam. Simple command following. So raise your right arm. They raise their right arm. Blink, and they blink. Nod your head. The next thing is intelligible verbalization. Can they say anything? The third, recognizable verbal or gestural yes-no responses without regard to accuracy. Let's think of an example. Are you hungry? Yes. Are you hungry? And that would mean no. And our last one is movements or emotional responses that are triggered by relevant environmental stimuli and cannot be attributed to reflexive activities. So this could be like their spouse or their child or their parent walks through the room and they watch their parent. They follow their parent, or something That's just an example. All right, so I present this question. What if the bedside exam of the patient doesn't show any signs that they are aware of what is going on around them? Does that mean that they are unaware? And this is what I have prepared. Are all patients who appear vegetative correctly diagnosed? Are all patients who appear to be in the persistent vegetative state based off of their bedside exam, are they all actually unaware of what's going on around them or with themselves? And with themselves. These patients, so here's the situation. You walk into the patient's room, and this is what you see. These patients have ordinary sleep cycles. They wake up and they fall asleep. But while awake, they appear to be unaware of anything happening around them. You may prick their finger and they wouldn't react to the pain. You may ask them questions and they wouldn't respond in any meaningful way. Their eyes may be open, they may blink, and they may move their head around. But if you held up a finger and asked them to follow it as you moved your hand from side to side, they wouldn't. Professor Owen, there's a professor, Professor Adrian Owen, who tested these patients in order to investigate if they are actually unaware. And he did this by using functional MRIs. He wanted to get a look under the hood. What can their brain tell us, even if the patient isn't able to tell us anything at all? His findings are remarkable and of the utmost importance for priests, Eucharistic ministers who visit the sick, medical workers, and family and friends of patients with disorders of consciousness. All right, so the study by Professor Adrian Owen, he came up with a brilliant way to communicate with apparently vegetative patients. So those are patients who wake up and fall asleep, but are unaware of what's going on around them or unaware of anything that's going on with themselves as well. This worked with a minority of patients who at the bedside tested as vegetative. So on bedside exam, the doctor could have examined them and said, okay, this person is unaware. He wanted to get a closer look. MRIs give us images of what regions of the brain become active during activities. A patient who appears to be vegetative cannot show signs of awareness with their bodies, but what they still have control over is their ability to think. Thinking activates the brain, and doctors can see that on MRIs. All right, Father Luke Deisinger's website called Owen a Crusader for the Unconscious. And here's a quote from a study done by Owen on this topic. Activation studies have been used to identify even conscious awareness in patients who are assumed to be vegetative, yet retain cognitive abilities that have evaded detection using standard clinical methods. Wow, that is mind-blowing. That you could have a patient who on bedside exam appears to be in the persistent vegetative state. They appear to be unaware of anything at all. And yet using MRIs, using activation studies, Owen and others have been able to communicate with these patients and to be able to understand that the patient is able to communicate back, but in a non-physical way, in a way that you can never see at the patient's bedside. And they did this by using MRIs. Okay, so what exactly did they do? What was their technique or plan of action? And here's a quote. Scott Rootley hasn't spoken or even followed family members with his eyes since his car accident 12 years ago. But he managed to indicate to doctors this spring that he was not in pain. And he did it by imagining his playing tennis. As researchers watched for certain areas of his brain scan to light up during a functional MRI, something he and neuroscientist Adrian Owen worked out as a sign for no over a series of sessions. The breakthrough technique proved Rootley isn't in a vegetative state as doctors thought. He's aware of the world around him. There's that key word, he's aware. Some people can look like they're vegetative, but still have awareness inside their head. I think it's a very important finding, said Brian Young, the neurologist at University Hospital in London, Ontario, who has treated Rootly for the past decade. And so you can look up a TED Talk on YouTube by Professor Adrian Owens, and he will go through in that TED Talk his method and what they found. And I believe when I watched that, instead of thinking of tennis as the signal for no, I believe in that, if I remember right, in that TED Talk, it was the signal for yes. Regardless, regardless of what they used in that study and in this one, the process is the same. That he would teach the patient who is apparently unaware of anything going on, and he would tell them, if you can understand me, when I ask you a question and you want to say yes, but you can't because you can't move and you can't use your body, instead to think about playing tennis. Or in this case, if your answer is no, to think about playing tennis. And on the MRI scans, that region of the brain would light up. And so he would instruct the patient to think about playing tennis, and they would see how the brain was lighting up in the normal area for that kind of function. And in the video, it's up in this top portion of the brain. And then when he would ask questions, he would say, okay, now, are you in pain? And then what the patient would need to do is, in this case, to say no, he would think about playing tennis. And so he can't move, he can't say anything, he can't make any signals at all. You don't even know he's aware of what's going on around him on the outside. But with the view of the MRI, the functional MRI, they would say, are you in pain? And they would see this same region of the brain light up as the patient thought about playing tennis, which meant, no, I'm not in pain. It's incredible. It's amazing that someone would or that we discovered that, so that these patients who are trapped in their bodies and unable to communicate in any way whatsoever, that we were able to figure out a way using modern technology in order to communicate with them, giving them a way to communicate with us. So here's an application for our ministries. The priest may be called to visit a patient who appears to be unaware, like in the case of the anointing of the sick of a patient in a vegetative state. He may enter the room and think, in a sense, that he is the only person in the room, even though there's a patient's body on the bed, right? What he needs to remember, or any person visiting a patient in the vegetative state, is that the patient in front of him may be completely aware, even though they cannot show it. This means that everything that we say matters, even though we are the only one who is able to talk or move or communicate in any meaningful way. This means that what we do while we are in the patient's room matters too, because the patient could be aware of it all. Like I said, this is mind-blowing stuff, and I'm so grateful to have discovered it as I'm about to go on in the hospital ministry this summer for a couple months. And this is what it caused me to think about, connecting this to the gospel. Jesus commanded us to love others as we love ourselves. If I ever end up in the shoes of one of these patients, I would want the priests, the nurses, my family and friends to treat me as if I was aware, even if they thought I wasn't. And I would want the church to pray for me, because I can't even fathom how great a cross it must be to be trapped in your body and for no one to realize that you are aware of what is happening around you. However, we can also keep in mind that this does not mean that all patients who are apparently vegetative are aware of their surroundings. One question to ask to ask is how many of the patients who are in the persistent vegetative state, how many of them go through this this kind of testing, to have functional MRIs taken as they're asked questions, and to see if they're able to communicate in that way. Is this something that they now do for all these types of patients? Or is it something that's just been done in rare instances? Is this something that the family can request? These are questions that I have going forward. So taking another step forward in the presentation onto our next topic, I'm going to give you a scenario. Due to the advanced medical technology of our times, people who are incapacitated can be treated in the ICU, the intensive care unit, with technology such as ventilators. A person can become unresponsive and unable to move or communicate. To help them meet their body's required needs, doctors can implant feeding tubes so that the body gets the nutrition and water it needs to maintain itself. If the patient is unable to breathe on their own, a ventilator can be used, which breathes for them. At some point, though, the body may look like it is alive, but the question is the patient still there? The body is, but what about their soul? So this is actually a question about what we'd call brain death. And here's a definition of death, and in it we'll see a definition of brain death. So first, let us define death. Death has in fact occurred when spontaneous cardiac and respiratory functions have irreversibly ceased, which rapidly leads to a total and irreversible loss of all brain functions. So in that first definition, we have three organs that are mentioned. We have the cardiac, that's the heart. We have the respiratory, those are the lungs. And then we have brain function. And so when we walk into a patient's room, I was a hospice nurse for a brief time, and you walk into a patient's room who's passed away, and they are not breathing, and their heart is not beating, and then you see rigor mortis, and you see that the body it's pretty obvious. The dead body's pretty obvious in that case. And so that's the first definition of death, and that's very, very obvious. However, things get really tricky. What if the heart is still functioning? What if the lungs are still functioning and these things are being maintained by life support? How about the brain? What if the brain isn't functioning? And so let's look at the second part of the definition. Death has in fact occurred when there has been an irreversible cessation of all brain functions, even if cardiac, the heart, and respiratory, the lungs, functions which would have ceased have been maintained artificially. So what if the brain irreversibly stops? Like it's never coming back, it's completely gone, and yet the heart and the lungs are still working. And what this definition is saying is that is in fact death, and it is in fact called brain death. And that comes from Father Luke Deisinger's website, which he is quoting from the 1989 working group of the Pontifical Academy of Sciences in that definition. So what's the logic behind it? Not all parts of the body are equally necessary to maintain life. For example, a person is still a person if their foot is amputated, or arm, or leg, or ear, or nose, okay? If you amputate certain parts of the body, the person is still 100% there. If John Doe has his foot amputated, he is still 100% John Doe, but he's without a foot, and he's not able to do the things that the foot would allow him to do. But who he is in his essence is still 100% there. However, the brain is the organ that unites our souls with our bodies. If our brain has died, even if the rest of the body is in a sense alive because of life support, the soul is no longer united to the body, which is essential to human life. In the case of coma, persistent vegetative state, and minimally conscious state, the patient's soul is still united to their body through their brain. In the case of brain death, the person's soul is no longer united to the body, and therefore the patient is considered dead. Here's a quote from the Pontifical Academy of Sciences that was made in 2008. And this is and they're turning to two of the greatest theologians in the history of the church, St. Augustine and St. Thomas Aquinas. And this is what they tell us. St. Augustine, who was the source of this Thomistic doctrine of the government of the body by the soul through an organ which is the principal instrument, is very clear in asserting that brain death is the death of the individual. Thus, when the functions of the brain, which are, so to speak, at the service of the soul, cease completely because of some defect or perturbation, since the messengers of the sensations and the agents of movement no longer act, it is as if the soul was no longer present and was not in the body, and it has gone away. So the reason for this quote, and it's technical and it's precise in its language, is to show that the church's understanding of brain death now that we looked at in that definition doesn't just come out of nowhere, but it's actually connected to a theology, to the theology of two theologians that go back over 1,000 years. St. Augustine, I believe, was about 1,600 years ago, and St. Thomas Aquinas would be more like, I think, 700 years ago. But regardless, this is not this is not coming from a brand new theology. It's coming back rooted over 1,000 years ago. Okay, now we can look at a theologian of the church who's much more recent, and actually not just a theologian, but a saint and a pope, St. John Paul II. And this quote comes from his address to the International Congress of the Transplantation Society. He said, "The complete and irreversible cessation of all brain activity, if rigorously applied, does not seem to conflict with the essential elements of a sound anthropology." What he's saying is that the irreversible cessation of brain activity, so the brain is completely shut down. Defining this as death in itself does not seem to conflict with a Catholic understanding of the human person. All right, regarding ventilators and extraordinary means of maintaining life, here's a quote from Father Luke Deisinger's website. And it's underneath the subsection of St. John Paul II. So the exact connection of St. John Paul II, maybe he quoted this, or maybe this is someone summarizing his view. And this is what it says on the website. The Church endorses Catholics in either decision to use or not use extraordinary means, including ventilators, to support loved ones. They are not morally obliged to do so and are to be supported if they choose so. And so it's not required to keep a loved one alive on a ventilator, or the patient themselves is not required to choose to be maintained, for their life to be maintained on a ventilator, but instead they're allowed to choose to allow the dying process to happen naturally. That's what that's saying. And so the application to our ministry is this: understanding brain death is essential for priests who will be consulted by families who have loved ones on life support. If the patient is brain dead, the family needs to understand that taking the body off life support is not killing their loved one. Their loved one is already dead according to the church, because their brain has completely shut down and is never coming back. And that in itself is enough to declare a patient dead. And so here's our bibliography. And that's the end of our presentation.